second line down the road sort of thing, not first line.
So it's nothing. I know it's the most expensive.
We can think about a second line drug
on the market at the moment. Is that one of the reasons why
we just don't use second line drugs? You know, we'd always start with the simple ones, and all drugs have side effects, and then, you know, we know what the side effects of paracetamol are, you know, very minimal. I'm sure you've taken it lots of times, and Nurofen, have you taken that before? And they're fine. You don't have asthma or...
No, I don't, no.
So they'll be fine.
So there's no way you'll give that to me today then?
No, not today. But you can, if it doesn't settle down, and I'm expecting it to settle down... So if I came
back, would you then give it to me if the painkillers didn't work, or...? We
can talk about upping the painkiller, you know, what the next step in the painkiller. I don't know much about that drug. We'd have to look it up together.
Right, okay.
But are you happy to sort of start, if you take paracetamol and ibuprofen regularly, every 4 hours you take the paracetamol and the ibuprofen, take that sort of 3 times a day.
Okay.
And then you can space it out a bit as things settle down. I'm expecting it should be fine by the beginning of next week, and if it's not settling down, then come back and we can talk about things again.
Right, okay. Okay, I'll go with that.
All right. Do you feel happy with that?
Not really, no, because I really did want to clear it up, but if that's what you're saying, then
it should clear it up. I'm not saying it won't. I think it will clear it up. I mean, it'll probably just clear up anyway, but the painkillers will just keep you more comfortable whilst it gets better.
Okay. Okay, I'll try it.
All right.
Thank you.
Nice to see you.
Penfold, and take a seat. I'm Dr. O'Reilly. What can I do for you?
I've come for an X-ray result.
Oh, right, okay. You've seen one of the other doctors?
Yes, I came last week.
Okay.
I'd had a cough and some phlegm and bits of blood in it, and
right.
They thought it might be an infection, but decided to do a chest X-ray.
Right, okay. Can you just run through for me a little bit of what led up to the X-ray, because I haven't seen you before. Had you been poorly for quite some time?
I've felt a bit tired for the past 6 months, and my appetite's not quite what it used to be, and I might have lost a bit of weight, I'm not sure, but I just didn't feel quite right, and decided when I started coughing and some blood, I thought I'd better come to the doctor's.
Right. Had you had any antibiotics? I mean, did the GP give you any antibiotics? No. Okay. Is there anything that runs in your family?
Not to know of.
Okay. Do you know what the doctor was trying to check out when he was doing the X-ray? Was he worried about
No, I think he just thought it was an infection. He wanted to make sure what it was before he gave me any treatment.
Okay. And do you smoke, can I ask?
Yes, I do. I used to smoke 30 a day, but since I came out, got a bit worried it might be something to do with smoking, so I've cut it down to about 15 a day.
Right, okay. And you've just been up to the hospital and had the X-ray, so you haven't really got anything. They haven't said anything to you?
No.
Okay. Well, I've got the X-ray report here, so that does help us. Had you had any worries of your own before you had the X-ray as to what might be going on here?
No.
Okay.
I just assumed it would be some sort of infection that you could give me some, perhaps antibiotics to clear up.
Right. You didn't have any other worries of any sort?
No.
No. Okay. Well, it's always difficult on an X-ray to be actually sure what they're looking at, but certainly the X-ray is showing up some shadowing on the lung. There is a chance it could be an infection, but the way it's looking on the X-ray, it's looking a little bit suspicious, as if there may be something a little bit more there, which is a bit of a shock, I think. Well,
what do you mean a bit more?
A bit difficult really, but I think there is a suggestion this could be something a bit nasty.
You mean? No. No, it's just an infection.
Well, they can't be sure on an X-ray, but there is enough there to make the X-ray doctor looking at the form feel a bit concerned.
No, can't be, no.
Okay. Sorry about this. This is really difficult coming to see a strange doctor and me not knowing you at all.
There must be something they can do.
Absolutely. I think at the moment all we've got is an X-ray. X-rays are not diagnostic, so we can't go off what's on the X-ray for sure. But if there is anything there, then we need to find out what's going on as quickly as possible so we can get it sorted out and put right for you. So, I know this is a shock, but I think what we have to do is we have to be able to work out together now what we do now to get you seen quickly by the right sort of specialist, because I think what they've seen on the X-ray needs checking out now a bit more carefully by a chest specialist. If it is an infection of some sort, then you're going to need some special sort of treatment if it's an infection. If it's something nasty, then you're going to be looking at needing different sorts of treatment. So we need to start to put a plan together. Can I ask you a little bit about yourself, Mrs. Penfold? Do you live on your own?
No.
Who's at
I'm
home?
retired, but my husband's just down the road going to the library.
Okay, and have you got any children?
Yes, but they've grown up and left home now.
Okay, and you're retired now?
Yeah.
What did you used to do?
Social worker.
Right, okay. The reason I'm asking that is because obviously you're going to feel a bit terrible now. I'm just wondering who's going to be at home when you go home. Your husband's going to be there.
Well, as I say, he's outside waiting.
Okay. It might be worth if you have a quick word with him when you go out. Maybe you and him might want to come back and then have a little chat again in a few minutes together.
Yeah, okay, then perhaps, yeah.
And that, because you're going to want to have a talk to him.
Yeah.
Are you otherwise all fit and healthy?
Not too bad, it seems to be.
Okay.
Apart from the cough.
Okay. When you come back, we can talk with your husband. So I suspect your mind's kind of gone a bit blank at the moment. But the kind of thing...
I just can't take it in.
No. What we need to do is start to put together a plan for me to explain about who we need to get you seen by and arrange to get you seen quickly. What I think we need to do is look at getting one of the chest specialists to see you so that they can actually see whether they want to have a look at the lungs in a different way with possibly a bronchoscopy. Do you know what that means?
No.
The bronchoscopy. You've seen or heard of people who've had like the telescope tests where they put like a flexible telescope?
Yeah.
Well, it's like a flexible telescope that they can give you something to put you to sleep a little bit, and they put the flexible telescope down into the lung. That's one way they can look at the chest. Or sometimes what they can do is they can do like a CT scan. Have you seen that on the telly where you go into the washing machine and you just lie there? Yeah. So what we'll be looking at is getting you seen quickly to probably have some more investigations done to have a look what's going on here. Okay. I know you're feeling shocked, but are there any questions or anything that spring to mind instantly?
No, I can't think of anything. I just can't take it in.
Did you have any suspicion at all that there might be something? No. Have you ever known anyone that's had anything wrong with their chests? Like this?
No. That's why I never thought.
I think it's made extra difficult today because I haven't been looking after you, so you don't know me at all, and I don't really know you from old. So it's always harder getting news like this from someone strange. But I think the best thing to do would be, is your husband planning to come and meet you back here at the surgery?
He'll probably be waiting outside.
Okay. Well, I think probably the best thing to do would be we'll see if we've got one of our rooms free, and if you and your husband want to have a little talk in one of our rooms, we'll make a cup of tea. And then maybe we could meet again. I've got a few more patients to see. So if I finish off a few more patients, then maybe I and your husband could just meet again in about half an hour and just see whether there's any other things we can just go through for you to ask, and we can sort some plans out.
Okay.
I think the important message here is that there is something on that X-ray that is definitely not right. I don't think we can be certain based on an X-ray. So although it's worrying, nothing's definite, but we do need to put some more tests now in place to find out what's going on. If there's nothing very serious going on, then we've put you to a lot of worry and trouble for nothing. If there is something serious there, then we need to get on top of it as quickly as possible.
I understand.
Okay?
Okay.
I'm going to take you out now. I'm going to get one of the girls to come. We've got a spare consulting room. We'll seat you in there somewhere privately. Just get your husband to come and we'll make you a cup of tea. And then we'll meet again in a few minutes, okay?
Okay, thank you.
There you go.
Come in.
Hi, Doctor.
Nice to see you.
See you too.
Please do have a seat.
I think so. That is Dr. Bourne.
How can I help today?
Well, I've got a problem with my hand. That's what I've come in about. I've probably had this trouble for about 4 or 5 years now, but it's a bit of gristly, sort of thickening up there, and that is causing me a bit of concern the last 4 or 5 months.
Just remind me how old you are now.
I'm 52.
Okay.
Yeah.
And so, over what sort of period of time have you noticed it being a problem?
I've had it for about, as I say, about best part of 5 years, but it's only been a problem for about the last 5 months.
Right. And what do you do in life? What's your work?
Well, I actually I do a bit of massaging and aromatherapy, and that is what's causing me a bit of concern, because nowadays when I try and sort of put my hand down flat, I get a lot of pressure, a lot of pain there. It's obviously affecting my work and that. And
so it's affecting your work in that it's painful.
It's painful.
Is it bending the finger much, or?
Well, it's not, but funny you should say that. My mother actually started with something similar to this some years ago, and she ended up with a bent finger, which is obviously part of my concern. I don't want to have to start with another profession of mine.
And so you're getting a bit of discomfort when you're massaging. At the moment, it's not quite interfering. Is it doing anything else? Is it affecting your social life in any way?
Not in any way like that, no. It's just mainly with my work side of things, and it's becoming more sort of painful at the end of the day's work.
And it's not stopping you doing anything at home? Or?
Not particularly, no.
Okay. And have you any idea what it is? Do you know what it is?
I don't know what it is at all, no. As I say, it started some years ago, and it was just like a bit of crystal sort of growing in there, really, but it's just got more.
And you said your mum had it. What happened to her?
Well, she started off with something similar, and she, as far as I know, she had no treatment or anything, and that. But her finger is actually bent right over now, and it's there permanently. And I just don't want to go down that line if that's a
similar thing. And have they offered to do anything for her?
No, she had nothing done.
She had nothing done.
No, hers is past that.
And so your main concern is really that it's going to interfere with your job, and it's going to affect things.
Yeah.
And anything else? You weren't worried it was anything sinister?
I don't think so. No, I've got no reason to believe that. No.
Okay. I'm just going to ask you some more general questions about your health. Right. You say that you work as somebody who does massage and so on.
Right, yeah.
What else have you done in your life? Have you ever worked with automatic tools, or have you worked with vibrating instruments?
No, not really. No, nothing like that at all. Nothing that I think that would have caused anything in the past.
You've never banged or bumped it or cut yourself in that area?
Not that I can remember.
Okay.
All, no.
And generally, your health. Do you come and see the doctor regularly? We haven't obviously met before. But
No, just general things. But normally I'm in pretty good health, really. Yeah.
And so you've never suffered with diabetes or epilepsy?
Nothing at all. No.
And you've not got any symptoms that would be suggestive of diabetes?
Nothing.
You're not more thirsty than normal?
No,
you're not peeing more often than normal?
No.
Nothing like that?
Nothing at all.
You've not lost a lot of weight recently?
No.
Okay. And what about sort of your general health? I mean, you look reasonably fit.
Yeah, no problems at all.
Do you do exercise and things?
I do a reasonable bit of exercise, with my job and that, and I'm on the move all the time, etc. Yeah.
Okay. And do you smoke?
I don't smoke at all. No.
And alcohol?
No, I used to drink sort of a bit some years ago, but I've not had a drink now for probably 4 or 5 years. I have an occasional drink, but very little.
And so, without wanting to sort of press too much, then prior to 4 or 5 years ago, were you drinking heavily?
I wouldn't. Well, it depends how you claim heavily. I would probably say I was having a couple of pints a day, that sort of area.
Right,
so not a big heavy drinker, but probably about a couple of pints a day.
Right. And no episode in your life have you ever been jaundiced? You know, when you go yellow.
No, nothing at all.
And you've never been in hospital or anything because of that?
No.
Okay. And is there anything else that you've noticed on your body? Any rashes or anything? Nothing that would worry you in any way?
Nothing at all. It's just basically this. Yeah.
All right. Well, I mean, what you're describing certainly is a Dupuytren's contracture. It's where you get a band of tissue on the tendon, just there, yeah. And what it does is just like it did in your mum's, that it slowly will pull the fingers towards you.
Oh, I see.
And eventually, if you leave it, then it will end up with your fingers being stuck to your palm.
Right. So what can we do?
And there are a number of the questions that I was asking you was all really to see whether or not there was a cause, or whether it was just one of those things that maybe runs in your family and it's just that's the way it goes. And it sounds certainly as if you haven't got diabetes or epilepsy, or you're not a smoker, so it doesn't sound as if there's anything particularly that's causing it. However, having said that, then on the one hand, it might well be worth doing some tests just to check, check your blood sugar and check your liver function and so on.
Yeah.
So, although that wasn't your concern, I'm not really addressing your concern, I think there would be value in doing some blood tests, and we could do those here, a fasting blood test.
Yeah,
I don't know what you feel about that.
Yeah, if you feel happy with that, I'm quite happy to go along with that, yeah.
And the second thing is, you talked about your massage, the fact it's now causing pain, but it's not interfering, but that you're quite concerned about that.
Yeah.
And so the question is what we can do about it. Now, the problem with the Dupuytren's contracture is it's something that is progressive, and by that I mean, just like your mum, it will slowly get worse.
Okay.
But if we operate or we do anything to it too early, then you'll end up with it getting worse anyway. So by the time it gets to about 20 degrees, so by the time it's just about so far is about the perfect time to operate on it.
I see.
And at the moment, it's still not quite there.
Okay.
So that sort of leaves us with a choice, really. If it really is interfering with your work and
it's starting to, yeah.
and it's bothering you, then actually we could refer you and get the surgeons to have a look at it now, or we could wait a little while, or actually, because the pain may be because the tendon's inflamed, we could give you some anti-inflammatories, for a few weeks and just see whether or not that will ease it. But bearing in mind that in the long term you are going to have something done.
Yeah, I was going to ask you if there's any cream, because obviously I use cream on my particular sort of job, and I was going to ask if there was anything in that sort of line.
I mean, there's been lots of different treatments for Dupuytren's. At one time, particularly in the States, they were injecting it with steroid, but it really doesn't seem to have been particularly effective.
Okay.
And equally, then creams that you apply over the tendon don't really seem to help.
Right.
It may ease the ache, an anti-inflammatory gel, or perhaps some of the sort of creams you use may ease it. And so I wouldn't say it would do any harm, but it's unlikely. It certainly won't cure it, and it's unlikely to.
Right. Okay.
It's unlikely to make it better. Well, it won't make it better. So what do you think? Whereabouts are you? Would you like to try something and then be referred, or would you like to be referred straight away with the concern about your work?
Well, it is the concern to say about my work. I mean, how serious do you think we are at that stage? I mean, do you think it would be advisable to get something done soon?
I think it's probably going to progress over the next 2 or 3 years, and you're going to end up having surgery at that point. But you might get good functioning. As I say, you can't ever stop this happening. What you do is you temporarily, you temporarily stop it, temporarily hold it. And so my advice would be, take some treatment at the moment. Let's keep an eye on it. Let's see you on a 6-monthly basis, and then and obviously if it suddenly got worse, I'd want to see you straight away. Otherwise, we would see you reasonably regularly. And
I'm happy to go along with that if that's how you feel.
And bring you out. And you talked about your grandma and so on. Who's at home with you?
I'm a married person, so I'm
right.
My wife.
So your wife.
It was my mother that's got the problem.
And is your wife concerned about it? Did she?
Well, only because